Next year, nearly 71 million Americans will finally get a raise, a long-awaited 2.8% Social Security increase, the biggest bump in 4 years. But what if I told you that most of that raise is already gone? What if the moment the money hits your bank account, Medicare quietly takes it back? This is the story of the raise that vanished, and the system designed to protect seniors that may now be failing them. In 2026, Social Security benefits will rise by 2.8%, about $56 a month. It sounds good. It sounds hopeful. It sounds fair. But inflation didn't wait. Healthcare didn't slow down. Medicare Part B premiums, the ones automatically taken out of Social Security checks, will jump nearly 10%, reaching $202.90 per month. The average retiree expected $57 extra next year, but will only keep $39. The annual Social Security COLA, the cost of living adjustment, is calculated using a metric called the CPIW. Not senior spending, not retiree budgets, not healthcare costs. CPIW tracks urban wage earners, workers, not retirees. And this is the flaw. Seniors spend more on categories rising faster than CPIW. Healthcare is up. Insurance is up. Housing is up. For 2026, Medicare Part B premiums rise 9.7%, nearly 4 times the Social Security increase. And because Part B premiums are deducted automatically, the raise is gone before retirees even see it. There is one protection: the hold harmless provision. If your COLA is smaller than the premium increase, Medicare can't reduce your Social Security payment. But that also means you get no raise at all. Here's the moment everything changes. The government shutdown delayed the CPI report used to calculate the COLA. An entire national system, affecting 71 million people, waited 9 extra days for a number because Washington froze. And then the number came: 2.8%, the most modest of increases. During a year of rising premiums, rising rents, and rising prices everywhere seniors look. Nearly 39% of Social Security recipients rely on it for all their income. Millions more depend on it to survive each month. Advocacy groups warn, this raise is going to hurt. For many seniors, a 2.8% increase doesn't cover real-life inflation. The CPIE, the index designed for older Americans, rose 3%. If COLA used CPIE instead of CPIW, retirees would have received more. According to multiple studies, Social Security has lost 40% of its purchasing power over the past 20 years. Not because benefits froze, but because expenses rose faster. Medicare premiums rise because healthcare costs rise. Healthcare costs rise because utilization rises. Utilization rises because the population is aging. The result is a hidden tax. Every time seniors get a COLA, Medicare takes a larger bite. This year's bite, $17.90 per month, erases nearly a third of the raise. In 1975, COLA was designed to protect seniors, but it was built on a measurement that doesn't match senior spending. The system is working exactly as designed, yet failing millions in practice. The Census Bureau says about 10% of older Americans live in poverty. Advocates say the real number is higher. And next year's COLA won't fix that. With the taxable maximum rising to $184,500, with more retirees entering the system, with the trust fund projected to shrink, the real crisis is not the COLA of 2026, but the COLAs that may not come after 2033. The 2026 raise was meant to keep seniors afloat. Instead, it revealed a deeper truth. America's cost of living adjustment system is no longer adjusting to the true cost of living. Millions depend on Social Security, but if the system cannot keep up with inflation, then the real question is, how long until a raise becomes a pay cut? Do you think Social Security should switch to the CPIE, the inflation measure for seniors? Tell us in the comments, because your answer might shape the future of America's most important benefit.